What is your approach when dealing with facial wounds? Hello and welcome to this week's Urgent Bite, brought to you by the Royal New Zealand College of Urgent Care. My name is Guy Melrose, and today I want to ask the community a question. How do you approach wounds to the face? Wounds form a big part of urgent care practice, and one of the skills we need is discerning which wounds can be managed within an urgent care setting and which need to be dealt with by a surgeon in theatre. Some of this will come down to clinician experience. Some of you might have surgical training prior to entering urgent care, so the range and skills of various clinicians within a clinic will play some part in determining management. It is obviously important that injuries to significant underlying structures are thoroughly assessed and referred appropriately. Likewise, wounds that are contaminated, old and dirty must be referred if we are unable to adequately clean them. We might refer due to issues with the patient, usually youngsters being unable to keep still, or there might be issues with adequately anaesthetising the wound. We might have to refer due to neurovascular injury or compromise, or underlying open fracture. But one area which raises a few additional problems is the face. All of the above issues apply to facial wounds, but there is the added component of cosmetic effect. So a clean, fresh wound that does not damage any significant structures, and which would be easy to simply close if it were on a thigh, becomes a different wound when it is across the face of a child, or any person for whom a scar is undesirable, which is most. Other issues might then come into play, such as distance from hospital, wait times to see a surgeon, family concerns, and clinician confidence, for example. These can be tricky to deal with, and each of us will have our own lines that, when crossed, prompt a referral. Let's take a moment to hear a thought from Professor Bruce Arroll, Director of the Goodfellow Unit and a Professor of Primary Care at Auckland University. This is a story from his time in the wilds of Canada.
The other two cases I thought I'd talk about, I've seen a couple of these things, and you're going to see these things in urgent care, is when people have got a chainsaw up a tree, and I think these days chainsaws have better protective gear, but I've seen two people who've actually, the chainsaw's come back and it's gone right through their face and down into their neck, and I've stitched those people up under local anaesthetic. It takes a long time, but it's very satisfying to do. And I have to say, I am amazed at how the face heals. You know, it seems like these people, you see them a year later and they've just got a tiny little scar, yet they came in and their whole, the whole face and neck was sort of opened up. So there were situations where I didn't have any choice. I couldn't send them off to the local hospital. One was in Canada and one actually was in Thames Hospital. And we did do that under general anaesthetic. That was just because we had a general anaesthetic available, but I stitched this guy up. But so I think it's just a testament to how good the face is at healing. We worry about the face. I mean, you come out of medical school worried about cutting the face, but actually it's the most forgiving part of the body because of the blood supply.
So for Bruce, he was the only and best option for these two patients, and a favourable outcome was achieved. But it would not be wrong to have tried to refer these wounds to a surgeon if you did not feel you were able to manage them with your skill set and resources available, or if there were concerns by yourself, the patient, or a family member regarding the cosmetic outcome. So I would be interested in hearing from the community with regards to your experiences dealing with facial wounds. Have you had any issues with unsatisfactory healing and scarring to a facial wound? What are your rules and red lines for these injuries? For example, do you refer all wounds that involve the vermilion border, or are you happy to close wounds that partially involve the border? Do you avoid repairing wounds in children? When do you use sutures versus glue or steri-strips? Let us know your thoughts via Facebook or podcast@rnzcuc.org.nz. We can keep feedback anonymous if needed, but we will look to discuss approaches to facial wounds in the main podcast at the end of the month, and having your thoughts will be useful and will add greatly to the discussion. Now, in the meantime, have a look at the website blog attached in the show notes. lacerationrepair.com is a great resource for all things wounds and has good instructions on all types of suture techniques and considerations for all kinds of wounds, including wounds of the face, tongue and eyelid. It is well worth a browse. Now, we'll be back next week with another podcast. I look forward to seeing you all then, but for now, thanks for listening.